Thank you. It's always wonderful. So my topic is second line treatment after progression from first line immunotherapy in metastatic non-small cell lung cancer. So this is the paper. It's a European study mainly from centers from France, Spain, and Italy. It was published in 2023 in the Lung Cancer Journal. So this is what the NCCN states in the second line, that if the patient has received previous IO, then the treatment options include docetaxel, pemetrexed, gemcitabine, ramucirumab with docetaxel, or patient can receive albumin-bound paclitaxel. So before these studies, multiple studies have been done which have tried to show what works best after first line immunotherapy with or without chemotherapy. So most of these studies, they are retrospective studies with a small sample size ranging from 73 to 124 and a median survival of around 9 months with a PFS of around 4.5 months. So there is basically not much, nothing much works after first line immuno plus chemotherapy. So coming to the topic of discussion, this study was led by Auckland et al. It was a multi-centric international retrospective studies from 14 centers. Patients aged more than 18 years who were diagnosed with non-small cell lung cancer with progressive disease after first-line chemo-immuno, or patients received IO regimens, and they were eligible for second-line chemotherapy. The primary endpoint was second-line overall survival. Secondary endpoint was second-line PFS and second-line objective response rate and second-line disease control rate. Around 63% received prior PD-1 inhibitor, 36% received prior PD-L1 inhibitor, and around 0.8% received the combination. So these are the patient characteristics. So what I would like to highlight that they defined they defined immunotherapy resistance as those patients who had a PFS of less than 6 months, and those who had a PFS of more than 6 months, they classified as responders. So both were equally taken. 52% had resistance to first line treatment, and 48% patients, they were responders. And the second line treatment was either taxane monotherapy or other chemotherapy like vinorelbine, or taxane plus anti-angiogenic or platinum based therapy. And PD-L1 expression was 0% in around 49% of the patients, 1 to 49% in 42.1%, and more than 50 in around 8.8% of the patients. So coming to the outcomes of this study, that is second line treatment outcomes after progression from first line chemo plus immuno. So you can see that in the overall population, the objective response rate was 16%, the disease control rate was 42.5%, 6 months PFS was 19%, and 6 months OS was 59.3%. Those patients that did better, they were taxane monotherapy and taxane plus anti-angiogenic based therapy, and also platinum based therapy. Those patients who had primary resistance to chemo-immuno combination did not do very well. They had an objective response rate of 11.3% only, with a disease control rate of 31.7%, 6 months PFS of 10.6%, and 6 month OS of around 45%. Those patients who were responders to first line chemo plus immuno, they did fairly better. The objective response rate was 20%, disease control rate was 53.8%, PFS was 6 month PFS was 26.8%, and 6 month OS was 73.6%. So coming to the PFS and overall survival, in the patients, in total patients, around 2.9 month was the PFS and 8.1 month was the OS. Patients who had received taxanes or platinum, they did better with a PFS of around 2.3, 4.4 and 5.8 months respectively for taxane plus anti-angiogenic and platinum. And similarly, OS was also better, and it was best with platinum based, it was 17.6 months. Those patients who had primary resistance to this combination had a median PFS of around only 2.3 months with OS of around 5.1 months. And those who were responders to this combination had a median PFS of 4.4 months and OS of around 12.7 months. So this is the Kaplan-Meier graph showing that platinum and taxanes did fairly better as compared to other regimens. So a lot has been going on to find what is the best treatment option. So this is a recently Merck has announced that their anti-TIGIT in combination with pembro plus dosi in the second line, although it showed a numerical benefit but failed to show any statistical improvement. So as of now, standard chemotherapy still remains the best treatment option in second line chemotherapy post IO plus chemo or combination of IO. And it has a very limited modest activity, and those patients who are resistant to first line treatment options, they do very poorly and they remain refractory. They are a refractory population that requires to be enrolled in clinical trial. So we can re-challenge with platinum-based chemotherapy based on the PFS of the first line treatment, or we can give taxanes in combination with anti-angiogenic for a selected group of second line patients. And these results highlight the need for new combinations and strategies in second line after progression following first line combination of chemo plus IO. Thank you.